Welcome back. There's been a recent viral outbreak causing global concern, and that is the Human Metapneumovirus, or HMPV. Now, with reports of overwhelmed hospitals in China, the world is definitely on high alert. So, the question is, what does this mean for Nigeria? How vulnerable are we to this outbreak? And what measures are in place to prevent its spread? According to the Nigeria Center for Disease Control and Prevention, or the NCDC, they are committed to safeguarding public health and are working closely with the Federal Ministry of Health and Social Welfare to monitor global development and take proactive measures. But beyond the assurances from the NCDC, there's a need for the public to understand what the HMPV virus is, its effects, and how it spreads. As we discuss Nigeria's preparedness, we'll also be exploring the importance of public awareness and education in prevention of this virus. We'll be joined to discuss this by Professor Oyewale Tomori, who is a virologist and the former VC at Redeemers University. Good morning, and thank you very much for joining us.
Good morning, and Happy New Year to you.
Happy New Year to you as well. Certainly hearing about a virus is not the way that we want to start a new year, and Nigerians are worried for obvious reasons, especially because if you look back at 5 years ago, sometime in February was when we had the first case of COVID come into the country. So, should Nigerians be worried about this new virus?
Certainly, sure. We should be worried. We had the experience, as you mentioned, 5 years ago. It's almost the same type of thing that is started. It started in China. Although this is a new virus, it's not COVID, it's not influenza. It's a virus that was actually discovered way back in 2001. But it seems to be the one causing the problem right now in China. And we should be worried. Because our people go to China, and the world is a very small place. Traveling up and down now is an easy thing, just like we had it in 2020. So it is possible that we can also have it here too.
Tell us exactly what the HMPV virus is.
As the name says, it's a pneumovirus. They call it metapneumovirus. Like I said, it's not like the influenza virus. It's not like the COVID. It's a different kind of virus, more related to what they call the respiratory syncytial virus. So it causes the same type of symptoms. People have cough, they have fever, they sneeze and spread the virus through their sneezing. They contaminate the environment, and that's how we get it. And the same system that we use for control of COVID will probably be the same we have to use because it's a respiratory infection. So basically, like I said, it's a new virus. Let me not say it's a new virus. It's a virus that is causing a major issue now. It's been there all along, like I said, over 20 years ago.
Yes, I mean, you based on what you said about the virus having been there, if you can help us turn down the volume of your TV, it's interacting with our conversation. But just to mention that the virus has been around, according to reports, since 2001. That's about 60 years. The virus, or over 60 years. The virus was first discovered in the Netherlands, they say. But I think my concern right now is if they say that, because that's part of what we're hearing, that we shouldn't be worried about this, how the virus has been here since 2001, how it's just a regular cold that's typically prevalent during winter. But if we remember how COVID occurred, China wasn't giving a lot of information until things had then gotten out of hand. So in this situation, are we expecting that China gives us full disclosure to maybe at least calm the fears of people around the world if they're saying that it's nothing to worry about?
Whoever is telling you there's nothing to worry about, please deceiving yourself. I think it's the right thing. We shouldn't panic, but at the same time, we should be prepared. I heard the NCDC said we have a moderate risk. What exactly is moderate risk? Let people know. We've had the experience before in 2020, and the world saw what's happening. I would rather be on the side of saying, I'm not giving you panic, but I'm saying get prepared. It has happened before. Virus is coming in different forms and ways. The fact that it's been there for a long time does not mean it cannot. Condition may arise, and the virus may re-emerge when given the right condition. And this may be what is happening. Indeed, China is not telling too much stories. WHO has been appealing to China to take something, and that's the reason why we in Nigeria should take it seriously. We should all these things about moderate risk. Why did they determine moderate risk? We don't even have the reagents for the current virus to test in Nigeria. So how do you know what risk you're talking about? How many cases have you tested? The influenza tests that we do normally at the beginning of the year. I mean, how much of the labs are working in Nigeria that we can say we're depending on the WHO to determine for us what the risk? We are the one to determine the risk in our different countries. Test your samples and be able to take that on, not what WHO. China is not talking, so how do you determine the risk?
Right. I mean, that's a very key point you've raised there. We can't determine, we don't even know what we are up against. We don't know what we are fighting against. Just to mention earlier, to correct something I said earlier about, yes, it was discovered in 2001 in the Netherlands, according to reports, but there are researchers who have argued that it's been around for as much as 60 years and, you know, it's just been going around. So I think the question here is, yes, we don't know what we're up against, but until we know what we're up against, how can Nigerians protect themselves?
I think the same thing we did. I think we learned a lesson from what happened in COVID. Improve our borders. You know where the cases are occurring now is in China. Therefore, one of the easiest way where it can come in. Actually, like the COVID came in from Netherlands for us, I think from France or something. So also, this can come from outside. Therefore, we need to monitor our borders. We need to monitor the ports where people are likely to come in with this disease. But if you see what is going on in our borders now, I think it's a joke. I've been through that with Lagos Airport. How many people are filling the forms? And even if we fill the forms, who is handling the forms? What are we doing with the forms? What information are we getting back to people? You're telling me to fill forms. You don't give me feedback of what you have found with it. And that's one of the areas where we're making an error. We need to be more serious with our borders. We need to be serious with the forms that we're telling our people to fill. We want people to tell them the reason why we're asking them to fill this form. And we must feed back to them that the forms we have filled, this is what we have done. We don't get that in this country. You just tell me, do this, do that. And I don't know what happens after that. Then the thing comes and booms, and then we have it. So we need to really, yeah, please go.
Yeah, I just wanted to ask. I mean, after COVID and the cases reduced and the world finally went back to normal, there have been many questions raised as to if the world really got the truth about what exactly COVID was, where it came from, if masks were really helpful, if the vaccines were truly relevant, if they really saved lives. There's too many things that, some people have said, these questions remain unanswered, or they haven't gotten any confident answers from the relevant authorities, of course, from the pharmaceutical industry, in the West. Do you think that that is still where we are? Can we trust the narratives of HMPV, seeing how COVID was addressed?
Yeah, I agree with you. There were a lot of errors made about COVID and all that, but I think we're focusing on the wrong issues. It doesn't really matter to me that much where the virus came from or how it came. Maybe you can learn something from that. But the problem was that it caused a lot of people, millions of people died. And let's separate the fact from the fiction. Millions of people died from COVID. There's no doubt about that. Many people didn't die in Africa, but when you look at the global thing, it was a major global issue. That's number one. Number two, the vaccines worked. Let's not deceive ourselves. Yeah, in spite of all the stories coming out, vaccines work, and these vaccines work. They were not perfect vaccines because there are also some problems with them, but they worked on the long run. And some of the stories that we heard about chloroquine being very good, now we know that those ones were not true. The chloroquine did not act as it said it was. So we are learning a lot of things. And I think the best we can is that seek the fact from the fiction of all about COVID and use the fact to learn your lesson. And that's the problem with this. COVID came to Nigeria, killed people got infected. This is a virus, and it's coming out from where it is coming there. We better be prepared for it. I'm not saying we should panic. We should prepare. We should learn from the lessons of COVID and do this thing. One good example. The only way you and I can make anything. Confirmation is how good is your lab? If you have to know that your cases are occurring from lab, people tested outside your country, something is wrong with your lab system. You remember we had, when we started with COVID, they said we had only about 3 labs. Then suddenly it boomed up to 160. Everybody was building labs all over. But do you know, even before COVID finished, 60% or more of those labs were no longer functioning because of the Nigerian factor got into everything. You know, these are issues we need to be addressing. Tomorrow, if this could become the NCDC can still not tell you because they don't have the reagents for the pneumovirus that is here. So are they telling you that the risk is low? You can't test, you are not testing, you are just depending on what WHO is saying, that the error we made in the past. These are lessons we need to learn. Build up your system. I use one word. I think when people are talking about restructuring politically, I think we need to restructure our disease surveillance in this country.
Yeah.
Take the control of the NCDC. Let each state and local government carry out their own surveillance. That's where the cases are occurring, and that's where the labs and the disease surveillance should be, not an NCDC in Abuja.
Yeah, I mean, I think a lot of people would agree with that. If we can decentralize, you know, how these healthcare policies are made, of course, you know, how move them to the states like you've mentioned. But aside the infrastructure, or rather aside the porous borders that you mentioned, what other levels of healthcare infrastructure do you think we're still lacking in that we would need to have in place if this becomes a full-blown virus?
Had the problem when we're running health setting up centers all over to take care of the number of cases. Now is the time to get your people ready. Get out of the Christmas holiday mood. We have the problem coming at hand. Get our IPC ready. Get, first of all, your first approach is your health workers. Make sure you protect them, because they are the ones that will eventually be taking care of the cases. Provide them with the basic necessities, the IPCs, the gloves, and the whatever, sanitation and all that thing. Keep up. Remember, we said this is spread. Somebody sneezes, contaminates the environment. So hand washing, all those factors which we knew about COVID should be in place. It's not, we shouldn't go on holidays with sanitation and all those things because we don't have cases. It's really an everyday affair. Our health centers must be a place where you can safely go and be sure that you're going to get something else because of the poor situations. Get our health workers working, continue the awareness, keep telling people about what is happening. How do you transmit this? How do you prevent it? How do you make sure that no other person gets around you? These are things we need to constantly be telling our people. I watch the TV, all you talk about is, my president went to France, my president went to toilet. What are we talking about the life of the people? This should be an actual everyday affair that we should be getting to our people. Your health, your living, your death, your life. These are important things, more important than where my president goes to or doesn't go.
All right, Professor Oyewale Tomori, thank you so much for your time with us this morning. Hopefully the next time we're speaking about this, it would have not yet become it won't have gotten worse. I think that's a better way to put it. We don't want a situation where Nigeria would have to deal with this because we cannot afford this right now. We cannot. Thank you for your time.
Thank you very much. I agree with you.
Yes.